Today we're going to talk about medical terminology. We have some vocabulary that goes with this. First, we have to know what an injury is. It's an act that damages or hurts. Next, you have an acute injury. It's characterized by rapid onset, meaning it happens quick and resulting from a traumatic event. So it's something that happens soon. Characterized by rapid onset, resulting from a traumatic event. Next, you have chronic injury. One characterized by a slow, insidious onset implying gradual development of structural damage. So it happens over a long period of time. Next, you have critical force. Magnitude of a single force by which an anatomical structure is damaged. So it takes force to create an injury. Next, we have a strain. A strain is an injury involving muscles and tendons or the junction between the two, commonly known as the musculotendinous junction. So a strain involves muscles and or tendons. Next, you have a sprain. It's an injury to a joint and the structure's primary ligaments and or joint capsules. So a sprain is an injury to a joint and the structure's primarily ligaments and or joint capsules. So strains happen to muscles and tendons, sprains happen to ligaments. Muscles, tissues that contracts and relaxes to make movement. Tissue that contracts and relaxes to make movement. Muscles. Ligament. It's a structure that connects bone to bone. Ligament connects bone to bone. Tendon. It's a structure that connects muscle to bone. A tendon is a structure that connects muscle to bone. Joint capsule. It's a sac-like structure that encloses the ends of a bone in a diarthrodial joint. Joint capsule. It's a sac-like structure that encloses the ends of a bone in a diarthrodial joint. Fascia. 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 It's a fibrous membrane that covers, supports, and separates muscles. Bursa sacs. A small fluid-filled sac that is in between tendon, muscle, and bone and acts as a cushion. It's a fluid-filled sac for friction purposes. Helps cushion the area. Soft tissue includes muscles, fascia, tendons, joint capsules, ligaments, blood vessels, and nerves. So anything that's soft, pliable. Hemorrhage is a discharge of blood. Avulsion, forcible tearing away or separation. Avulsion, forcible tearing away or separation. Catastrophic injury, one involving damage to the brain and or spinal cord that presents a potentially life-threatening situation or the possibility of permanent disability. That's a catastrophic injury. Contusion, it's a bruise or injury to the soft tissue that does not break the skin. Ecchymosis, black and blue discoloration of the skin caused by hemorrhage. You often see that during a contusion. Hematoma, a localized collection of blood, usually clothed, that is confined within an organ, tissue, or space. And I believe that should say closed, not clothed. A localized collection of blood, usually closed, meaning it's in the body, that is confined within an organ, tissue, or space. Myositis ossificans. Myositis marked by ossification within a muscle. Ossification is a calcification process. So when you injure a muscle, if the blood sits there long enough, you get a hard ossification or a calcium deposit within the muscle if it's not taken care of. Fracture, a break or crack in a bone. Crepitation, crackling sound heard during the movement of a broken bone. It's kind of this creaking, eerie sound. Stress fracture, a small crack or break in a bone related to excessive repeated overloads, also known as overuse fracture or a March fracture. Epiphysis, it's a cartilaginous growth region of bone. So basically it's at the end of a bone and it's where cartilage grows. It's the epiphysis, the end of a bone. Dislocation, the displacement of contiguous surfaces of bones compromising a joint. The displacement of contiguous surfaces of bones compromising a joint, meaning one of the bones comes out of the joint. Dislocation. Subluxation, partial or incomplete dislocation of an articulation. Meaning it tries to come out of the joint, but it doesn't come out all the way. Next you have luxation. It's a complete dislocation of a joint. I have to learn how to say it right. Here we go, kids. Let's try this again. Epidemiology, the student of the distribution, or should say the study of the distribution of disease or injury within a population and its environment. Epidemiology. I'm going to say it right one of these times. Let's get it right here. We're going to say it 3 times real slow. Epidemiology. The study of the distribution of disease or injury within a population and its environment. Risk factor. It's a causative agent in a sports injury. Risk factor. Causative agent in a sports injury. Spearing. You practice and tackle football. I can't speak today, folks. We're going to try this again. Spearing. A practice and tackle football whereby a player performs either a tackle or block using the head as the initial point of contact. It is illegal. People still try to do it. Apophysis, bony outgrowth to with muscles attach. Wow, I should have checked these kids. I'm going to try this again. A bony outgrowth to which, not with, but which muscles attach. Apophysis, bony outgrowth to which muscles attach. Apophysis, bony outgrowth to which muscles attach. Friction, heat producing. Tendinitis, inflammation of a tendon, muscle attachments, tendons, or both. So it's an inflammation of that area. Ectopic, located in a place different from normal. Ectopic, located in a place different from normal. Tenosynovitis, inflammation of the sheath covering a tendon. Tenosynovitis, the inflammation of the sheath covering a tendon. Bursitis, inflammation of a bursa at sites of bony prominences between muscles and tendons. So we talked about the bursa sac earlier. It's when that bursa sac becomes inflamed. So then you have bursitis, causing the inflammation of the bursa at the sites of bony prominences between muscles and tendons. I like Jace's take here. Here's my take on high school reunions. If I haven't contacted you in the last 20 years, there's probably a reason. I think he's right. Probably didn't want to talk to you. There's your medical terminology.